Hello everyone, we are continuing with nutrition during lactation, and this time we want to look at the conditions and the interventions. There are two key considerations that are related to conditions and interventions during breastfeeding, and one, the vast majority of women do not experience significant problems during breastfeeding. Most of the women are okay, they do not have any challenges. But most problems could have been prevented with proper prenatal breastfeeding education, and also a positive breastfeeding initiation period is very important and can prevent any of these breast conditions during lactation. The common breastfeeding conditions we have are sour, flat or inverted nipples, latch-down failure, hyperactive latch-down, hyperlactation, engorgement, plugged ducts, mastitis, and low milk supply. And we are going to look at each of these conditions and how we can try to intervene in the mothers. Sour nipples. The condition of sour nipples can cause obstruction of lactation because the mother is going to feel pain during breastfeeding and can cause risks of infection to the infant. And this condition can be prevented by proper position of the baby on the breast. The areola should be in the baby's mouth with the tongue extended against the lower lip. Flat or inverted nipples. Some mothers happen to have flat and inverted nipples, and this is going to also obstruct breastfeeding. And this condition should not impact breastfeeding if the latching is correct. But if it's difficult to latch, the mother may have to roll her nipple between her fingers in order to invert them, to release them from being inverted. And the mother can also use a breast pump prior to feeding, which will help to draw out the nipple. Let-down failure. This is happening when milk does not eject from the breast, and this is a very uncommon condition. But if it occurs, oxytocin nasal spray may be prescribed. This is going to increase the amount of oxytocin that will cause contraction of the ducts and then release of breast milk. Hyperactive letdown. This is where streams of milk come from the breasts, and if the breasts release milk at a very active rate, this may cause the infant to choke while nursing. So the management here is to wait for the milk flow to slow down before putting the infant to the breast. The mother may also express the milk until the flow slows, then allow the infant to nurse. Hyperlactation occurs when milk volume when the milk volume produced exceeds the intake of the baby. And the symptoms in the mother may include breast not drained completely, then chronic plugged or blocked ducts, leaking between feet, and pain with let down or deep in breast. So the symptoms in the baby will be poor weight gain. The management here is you have to express the breast milk and nurse the baby on one side only. Another condition is breast engorgement, and this occurs when the breasts are overfilled with milk and results when the supply and demand process is not yet established and the milk is abundant. The best way to prevent this is to nurse frequently. The newborn may nurse every 1 to 2 hours. Plugged ducts. This is caused by milk staying in the ducts, and it causes the breast to become painful. And this is treated by massaging the breast and by using a warm compress on the breasts. And you can prevent this by complete emptying of the breasts and changing the position of the infant while feeding. Feed the baby on one breast, and when the baby is done with that, change to the next breast. Mastitis. This is a result of infection that causes inflammation of the breast. And this occurs in about 3 to 20% of breastfeeding women. And it's most common at about 2 to 6 weeks postpartum. May result from sour and cracked nipples, blood-borne source of bacterial infections, and missing a feeding which results in engorgement, and then plugged ducts may precipitate this engorgement. Low milk supply. This is the most common reason for cessation of breastfeeding. The baby gets irritated if she tries to suckle and it's not getting enough breast milk, and so the baby may end up rejecting the breast. And some of these conditions can be perceived by the mother. It can be a mental. The mother may think that they do not have enough breast milk, and this is going to impact the child. And the cause is insufficient breastfeeding or pumping, ineffective emptying, and stress. The management here is the mother has to avoid stress and has to make sure that she empties the breast completely. She has to nurse or pump the breast every 2 to 3 hours. She has to nurse the infant frequently. The safety of oral contraceptive use during lactation. The current evidence suggests that combined oral contraceptives may reduce the volume of breast milk, and the World Health Organization has recommended against the use of the combined oral contraceptives during the first 6 weeks of postpartum. And also the use of a copper IUD or other non-hormonal birth control methods is encouraged. Alcohol and other drugs. The drugs that may impact lactation are alcohol, nicotine from smoking cigarettes, marijuana, caffeine, and other drugs of abuse. Alcohol consumed quickly passes to the breast. So the level of alcohol in breast milk is the same as in maternal plasma. The peak plasma levels occur at about 30 to 6 minutes after consumption if consumed without food. But if it's consumed with food, it occurs about 60 to 90 minutes. And alcohol consumption decreases the levels of oxytocin and also reduces the level of the let down milk. The impact of alcohol on lactation, it affects the odor of milk, and this decreases the volume consumed by the infant. If the infant perceives an unpleasant smell from the breast, she may reject the breast or suckle less. Other drugs such as nicotine, smoking cigarettes. Regardless of the feeding choice, the health risks for infants posed by a smoking mother are many. For example, otitis media may occur, respiratory infections, and gastrointestinal dysregulation. And these levels are 1.5 to 3 times higher in breast milk than in the mother's blood. Marijuana can also be transferred into the breast milk, and it concentrates in the breast milk and can be metabolized by the nursing infant. So it's very dangerous to take in any of these drugs when you're a nursing mother. Caffeine. Moderate intake of caffeine causes no problems for most breastfeeding infants and mothers. The levels in breast milk is about 1% of that in the mother's plasma, and this may accumulate in infants that are younger than 3 to 4 months and may interfere with sleep and cause hyperactivity and fussiness in the infant. Breastfeeding multiples, for example, twins, triplets, and quadruplets. It's very possible to breastfeed normally when you have multiples, but the main obstacle here is the time and fatigue of the mother. So it's important to support the mother during this time. And frequent nursing also increases milk supply. The parents of multiples need support in their feeding and also in stress management. It's important that they reduce stress so that the breast can produce enough milk to support the 2 or more children. Breastfeeding and HIV infection. There is very little chance that HIV can be transmitted to the infant through breast milk, as long as the breast has no sores. So the Ministry of Health has recommended that HIV positive mothers should breastfeed for at least 1 year while taking their ARVs. But if the mother has sores, it's important to not give the baby the breast because they might get infected through the sores. Human milk collection and storage. It's possible that human milk can be collected and stored and used in other babies that may not be having mothers. For example, those that lost their mothers. at delivery. So if breast milk is stored at the right temperatures in the refrigerator or in the freezer, it can stay for over 1 week. So freshly expressed milk, when placed in a closed container, can stay at room temperature for 6 to 8 hours at a temperature of 7 to 8 degrees Fahrenheit or lower. In the refrigerator, it can take 3 to 5 days at 39 degrees Fahrenheit or lower. And in the freezer, it can take about 2 weeks in the freezer compartment inside the refrigerator. And it can take 3 to 6 months in the freezer section of a refrigerator with a separate door. And it can even last up to 12 months in the deep freezer at 0 degrees Fahrenheit. But if the milk was previously frozen in the refrigerator but not warmed or used, at room temperature it should not stay for 4 hours. It should stay for less than 4 hours and should be used. In the refrigerator, it could stay for 24 hours. It should not exceed 24 hours. And it's not again encouraged to freeze this milk again. Once it's out of the freezer, it has to be used. If the milk is stored outside the refrigerator in warm water, at room temperature, it should be used for completion of feeding. It should be used immediately. In the refrigerator, it can be stored for about 4 hours or until the next feeding. It is also not advisable to freeze this milk again. If the infant has started feeding on this milk, it's important at room temperature to use only for completion of feeding, and then you discard the remaining. It's not advisable to refrigerate or to freeze milk that the infant has really started taking. Milk banking. Human milk banks provide human milk to infants who cannot be breastfed by their mothers. And some units in ICU have milk banks. Until in the earlier years, some units in the ICUs had milk banks until the 1980s, when HIV infections and the resurgence of TB and other risks became prevalent. Then this practice was paused because of the high risk of infection of the infants. Neonatal jaundice is a yellow color of the skin seen in about 60% of full-term and 80% of preterm infants. This is also called hyperbilirubinemia. And if it's not resolved, these high bilirubin levels can cause permanent neurological damage. It is most frequent cause for hospital readmission for newborns. It begins after the first day of birth and rises steadily with a peak at around day 6 or 7. The bilirubin levels are about less than 12 milligrams per deciliter. However, this condition resolves within a few days, and it is caused by normal heme breakdown by the liver. Bilirubin metabolism. Bilirubin is a pigment produced as heme from red blood cells breakdown, and is usually processed by the liver and excreted in the baby's stool. The newborn's liver is not yet fully mature, so this is why jaundice is so common during the first few days of life. In the fetal state, there are high levels of hemoglobin, which were very important in the carriage of oxygen delivered by the placenta. But at birth, the infants may have high levels of hemoglobin. And as the infant breathes on his own or her own, this high hemoglobin is no longer needed, and that is why the red blood cells begin to break down. This color appears first in the face and then the upper body, and then progresses downward towards the toes. Bilirubin is very toxic to cells and may cause brain damage. The brain and the brain cells are destroyed by bilirubin, and these cells do not regenerate. There is a 50% mortality rate for infants that are affected by bilirubin encephalopathy. And this condition may cause cerebral palsy, hearing loss, and intellectual handicaps. Breast milk jaundice syndrome. This sets on later than physiological jaundice, typically from about the 7th to 10th day. It occurs in a third of breastfed infants. who are jaundiced at 3 weeks. The cause is unknown, and it's thought that more bilirubin is reabsorbed due to factors in the breast milk that promote its absorption. And this condition typically resolves itself, but in severe cases, it is treated like regular physiological jaundice. The treatment is by phototherapy for about 15 minutes, 4 times a day. And how does this phototherapy work? Light is absorbed in the bilirubin, which changes it to a water-soluble product that can be easily excreted via the kidneys. And it is encouraged that the mother should continue to breastfeed the infant, even during the treatment. So this is what we have for the various conditions that may affect lactation. Thank you.